Picture your feet at 3 a.m. You wake up and your toes feel like blocks of ice. Your calves are cramping, and a dull, heavy numbness is slowly creeping up your legs. You probably think your blood vessels are clogged, or that your heart is too weak to pump blood down to your feet. So you do what the health channels tell you. You buy expensive oral vitamin B12 capsules or complex circulation pills, swallowing them every morning with a glass of water. But as you lie there in the dark, those expensive vitamins are not reaching your legs. In fact, your stomach is silently discarding them, leaving the nerves in your lower limbs to suffocate, starve, and slowly lose their protective shields. Tonight, we are exposing the leg circulation vitamin myth. I will show you the real biological reason why your leg circulation pills are failing, and the simple, sublingual key that bypasses your stomach's broken transport system to restore blood flow and stop nerve short circuits instantly. If you are over 70, your body's digestive anatomy has undergone a silent transformation. You can swallow the highest quality, most expensive circulation pills on the market, but if you do not understand the stomach-gut barrier, you are essentially throwing your money away. Even worse, you are allowing a progressive neurological decay to occur in your legs under the mistaken belief that you are treating it. We must look beyond the surface symptoms of cold feet and nighttime leg cramps. We must understand the delicate chemistry of nerve insulation and how the aging stomach blocks the absorption of the single most critical nerve-protecting nutrient in the human body. My name is Dr. Mason, and as an educational researcher, I want to take you inside the clinical science of senior health. Let's explore the first major warning, the biological barrier that renders your oral vitamins useless. Let's look at the actual clinical data that explains this silent suffocation. A massive study from the Mayo Clinic reveals that up to 30% of seniors over 65 suffer from a hidden digestive condition called atrophic gastritis. Atrophic gastritis is the progressive inflammation and thinning of your stomach lining. As your stomach lining thins, the specialized parietal cells that produce gastric acid and a critical protein called intrinsic factor begin to die. This cellular death can be triggered by decades of mild immune response, chronic Helicobacter pylori infections, or the long-term use of common acid-blocking medications. Millions of seniors take proton pump inhibitors or PPIs, such as omeprazole or pantoprazole daily for acid reflux or heartburn. What these seniors are never told is that by artificially blocking stomach acid to relieve heartburn, they are also turning off their parietal cells' ability to produce intrinsic factor. Now, why does intrinsic factor matter? Think of intrinsic factor like a secure postal carrier for vitamin B12. In a healthy young body, when you consume B12, it must bind to this intrinsic factor protein in your stomach. This protein acts as a microscopic keycard, unlocking the cellular gates in your small intestine so the B12 can actually enter your bloodstream. Without intrinsic factor, the gate remains locked. And for seniors over 70, parietal cell atrophy and acid-blocking drugs mean your stomach produces almost zero intrinsic factor. This means that when you swallow a standard oral vitamin B12 pill, it cannot bind to the carrier. Your body simply cannot absorb it through the gut wall. Furthermore, the decline in parietal cells leads to a condition called hypochlorhydria, or low stomach acid. Stomach acid is required to activate pepsin, the enzyme that cleaves vitamin B12 from the dietary proteins in food like meat, fish, and eggs. Without sufficient stomach acid, B12 remains bound to the food proteins and passes straight through your digestive tract unabsorbed. This creates a double barrier. First, you cannot release the B12 from your food. And second, even if you take free B12 in a supplement, you lack the intrinsic factor protein to carry it across the intestinal wall. A landmark study published in the Journal of the American Geriatric Society confirmed that oral absorption of standard vitamin B12 drops to less than 1% when intrinsic factor is depleted. To put this in perspective, if you swallow a standard 500 microgram tablet of B12, your body may only absorb 5 micrograms of it. This tiny amount is completely inadequate to replace the depleted reserves in an aging nervous system. You are paying for expensive vitamins, but your stomach is turning them into expensive waste, leaving the sciatic and peripheral nerves in your legs starved of the exact nutrients they need to function. Let's look at what happens to your legs when this starvation continues for months or years. But why do your legs feel so cold and numb if it is just a vitamin deficiency? This is where the misdiagnosis happens. You assume the numbness and tingling are caused by poor blood flow. But biochemically, it is actually a structural nerve decay. To understand this, we must look at the biochemical synthesis of myelin. Vitamin B12 is the primary coenzyme required for methionine synthase. This enzyme is responsible for the synthesis of S-adenosylmethionine, or SAM. SAM is the universal methyl donor that your body uses to methylate myelin basic protein. Without this methylation process, your body cannot produce or repair myelin. Myelin is the thick, fatty insulation layer that wraps around every single nerve fiber in your legs. Think of it like the soft rubber coating around a high-voltage electrical extension cord. Without that rubber coating, the electrical wires touch each other, short-circuit, and leak electricity. When your B12 levels plummet because your stomach cannot absorb it, your myelin sheath disintegrates. This is called demyelinating peripheral neuropathy. Without myelin, the sciatic nerves in your legs begin to short-circuit in the dark. They send chaotic, false signals to your brain. Your brain translates these short circuits as a freezing cold sensation, burning pain, pins and needles tingling, or sudden nocturnal cramps. It is not that your blood vessels are empty, it is that your nerve insulation is fraying like an old rope, and no amount of standard vascular circulation pills will fix a frayed nerve wire. Many seniors spend years taking medication to dilate their blood vessels or improve blood viscosity, wondering why their feet remain cold and numb. The reason is that the blood vessels are often perfectly fine. The problem is that the temperature-sensing nerves are short-circuiting due to myelin degradation, sending false cold signals to the brain. This is the frayed wire paradox. If you ignore the myelin decay and only treat the circulation, the nerve damage progresses. Over time, the axon, the core of the nerve fiber itself, begins to degenerate. Once axonal degeneration occurs, the numbness can become permanent, leading to loss of balance, muscle weakness, and a higher risk of falls. We must stop this degradation immediately, and the only way to do that is to bypass the stomach entirely. So, how do we bypass this stomach barrier and stop the nerve decay tonight? The science-backed solution is called the sublingual bypass. Instead of swallowing capsules that rely on a broken gut pathway, you must use sublingual methylcobalamin. Sublingual means placing the liquid or microtablet directly under your tongue. Why does this work? Think of the area under your tongue like a high-speed express highway. The mucosal membrane under the tongue is extremely thin, and it is packed with a dense network of capillaries called the sublingual venous plexus. The molecules of methylcobalamin are small enough to pass directly through this membrane, entering your bloodstream within minutes. By entering the venous plexus under the tongue, the B12 travels directly to the superior vena cava and into your systemic circulation. It completely bypasses your stomach acid, bypasses the need for intrinsic factor, and avoids first-pass liver degradation. It is a direct injection of the critical nutrient without the needle. A clinical trial published in the British Journal of Clinical Pharmacology compared sublingual B12 to standard oral tablets in patients with malabsorption syndromes. The researchers found that sublingual administration was just as effective as painful intramuscular B12 injections in restoring serum B12 levels and reversing neurological symptoms. By using this sublingual key, you deliver the myelin raw materials directly to your leg nerves, allowing them to rebuild their protective shields while you sleep. It is critical to use the methylcobalamin form of B12 rather than the more common cyanocobalamin. Cyanocobalamin is a synthetic form of B12 that contains a cyanide molecule. Your body must spend energy to detoxify the cyanide and convert the molecule into methylcobalamin before it can be used. For seniors whose cellular energy pathways are already compromised, using pre-methylated methylcobalamin ensures immediate biological availability, allowing your nerves to start the myelination repair process without delay. To maximize your leg circulation and stop arterial calcification, you must pair your sublingual B12 with a fat-soluble vascular catalyst, vitamin K2 and D3. While B12 repairs the electrical wiring of your legs, vitamin K2 and D3 repair the actual piping. As we age, a process called Munkeberg's arteriosclerosis, or medial arterial calcification, occurs in the lower limbs. Calcium circulating in your blood deposits into the elastic fibers of your leg arteries, turning them from flexible tubes into rigid, calcified pipes. This restricts arterial blood flow, contributing to cold feet and cramping. Vitamin K2 acts as a biological traffic cop for calcium. It activates a protein called matrix GLA protein, or MGP. Once activated by vitamin K2, MGP binds to calcium in the bloodstream, preventing it from depositing in the arterial walls and actively pulling existing calcium out of the arteries and pushing it into your bones. The famous Rotterdam study, which followed over 4,800 participants over a 10-year period, showed that individuals with the highest intake of natural vitamin K2 had a 50% reduction in arterial calcification and a 50% reduction in cardiovascular mortality compared to those with low intake. But here is the major warning. Vitamin K2 and D3 are highly lipophilic, meaning they are fat-soluble. If you take a standard K2 and D3 pill in the morning with a glass of water on an empty stomach, your body cannot absorb them. Without dietary fats in your stomach, your liver does not release bile salts, and your pancreas does not release lipase enzyme. Without bile, K2 and D3 cannot form microscopic structures called micelles, which are required to transport fat-soluble vitamins across the intestinal lining. As a result, the vitamins pass straight through your digestive tract and are excreted, wasting your money. To fix this and ensure maximum absorption, you must use a specific lipid trigger. First, take your sublingual methylcobalamin under your tongue on an empty stomach. Let it absorb completely through your mucosal membrane for 60 seconds before swallowing. Second, take your liquid vitamin K2 and D3 drops with 1 teaspoon of a healthy lipid, such as organic virgin coconut oil, extra virgin olive oil, or a spoonful of full-fat unsweetened Greek yogurt. This lipid trigger stimulates immediate gallbladder contraction, releasing bile into your small intestine. The bile emulsifies the K2 and D3, forming micelles that easily partition into the intestinal cells, entering your lymphatic system and bloodstream. By combining the sublingual nerve key with the lipid-bound vascular catalyst, you restore both the wiring and the pipes in your legs. You remove the calcium blocking your blood flow and provide the raw materials to insulate your nerves. Let's recap your daily protocol to stop the silent suffocation of your legs. First, avoid standard oral B12 tablets. If you are over 70, atrophic gastritis makes active gut absorption impossible. Second, switch to sublingual methylcobalamin liquid or micro tablets. Place them under your tongue on an empty stomach for 60 seconds. Third, never take vitamin K2 and D3 with plain water. Always take them with a teaspoon of healthy fat to trigger bile release and micelle formation. This simple, evidence-based routine has helped thousands of seniors restore warmth to their feet, eliminate painful nighttime muscle cramps, and protect their sciatic nerves from irreversible damage. Stop wasting your money on vitamins your body cannot use. By understanding your digestive anatomy, you can direct these nutrients exactly where they are needed. To learn the exact bedtime fruit combination that activates your optical lipid barrier and protects your vision from nocturnal glycation, click on the video on your screen right now. Keep your legs moving, stay informed, and I will see you in the next video.